patient with sore throat is given antibiotic as a treatment by the doctor. So what causes this sore throat? So the keyword there is antibiotic, and we know that antibiotic is a set of drugs that can be used to treat bacteria only. So the answer would be A. Okay, question number 2. Which disease can be cured by antibiotics? So antibiotics is a type of drug that can only kill bacteria. So HIV/AIDS is a type of autoimmune disease that is caused by a virus, not caused by a bacteria, so therefore cannot be treated by antibiotics. For the second option, diabetes is a condition whereby there is too much glucose in the blood, or the pancreas no longer produce enough insulin. Therefore, it's not caused by bacteria, cannot be treated by antibiotics, but needs to be given insulin injection, for example. Emphysema is a type of condition whereby the alveoli has erupted or disrupted or becomes bigger in size. So alveoli normally this sized. It is normally compact in structure. These are where the gaseous exchange will take place. But with people with emphysema, the walls erupted. So these alveoli, instead of there's many of them, you can see that it becomes like one large ones mixed together between the few. So which means there's less alveoli here. If that means that damaged, the alveoli are damaged, therefore the surface area is also affected. So the idea with alveoli is it is small, it has larger surface area to volume ratio, therefore gaseous exchange between carbon dioxide and oxygen are quite fast. On the other hand, if the walls are broken, then gaseous exchange can no longer be as efficient as before. So the person with emphysema are normally suffering from breathlessness or not enough oxygen taking in, not enough carbon dioxide being secreted out. So efficiency of gas exchange is less with people with emphysema. These are normally in people who are smoking or tobacco smokers. So not emphysema. The answer is actually syphilis. So this is something that we'll come across when we're doing topic 16 or 17, sexual reproduction in human. This is a type of STDs, viruses caused by bacteria, so it can be cured by antibiotics. What is an antibiotic? It's a chemical produced by fungus that kills bacteria. That is the definition of antibiotics that you need to know. So question number 4. Question is saying about they want to compare how different antibiotics work. So in an experiment, we need to make sure things are constant if we want to compare with different antibiotics. So concentration of antibiotics should be the same. So if we're using antibiotic A, B, C, and D, the concentration should be the same. The size of filtered paper disc should also be the same, because we want to make sure we are doing a fair testing on all of the antibiotics. But we're going to change the antibiotics, right? Because we want to see how well different antibiotics work together. So this antibiotic would be different. So the answer would be A for this one. Okay, so question number 5. For this graph, it's saying that showing the effect of 4 different antibiotics on the growth of a population of bacteria. So how does the antibiotics, we know that antibiotics kills bacteria, so we need to make sure we understand very well the graph. What are the information telling us? Because graph can be a bit confusing, so just take some time to understand the graph. The x-axis is showing the time in hours, and the y-axis is showing the percentage growth in reduction. percentage reduction in growth. So basically, the more the number, then the more the bacteria has been killed, basically. That's what the number is telling. So the greater the number, the more effective the antibiotic is, because they have killed lots of bacteria. So which of the statements is correct? Antibiotic W is more effective than antibiotic X against bacteria after 10 hours. Let's have a look at antibiotic W. That's antibiotic W after 10 hours katanya. Antibiotic W is more effective than antibiotic X, which is not really true, because we can see here antibiotic X is still higher after 10 hours. So antibiotic X is still more effective than antibiotic W. If the statement were to say maybe after 25 hours, then this would be more correct statement. So nope, not A. Antibiotic X is more effective than antibiotic Y against the bacteria. Antibiotic X is this one here, is more effective than antibiotic Y. Yep, that is correct, because this one has reduced the percentage growth is more, percentage reduction in growth is more than in Y, so that is correct. Antibiotic Z is more effective against these bacteria comparing to the other four, which is not true, because it hasn't really reduced the percentage of growth of bacteria. So the answer is only 2. Alright, moving on to effects of heroin. What are some effects of heroin? Okay, so whenever people are abusing drug, there will be some sort of withdrawal symptoms. Yep, so that's true. Injecting it can lead to AIDS. Yes, sharing the needles of the injections and not obviously they're not sane enough to use clean needles. Sometimes people who are just desperate to use any needle they found, which might not be clean, so that's how it can lead to HIV infection or AIDS. So yes, that's true. So between A and B. It stimulates the nervous system, so that means this type of drug is a stimulant. Is that true? So heroin is actually not a stimulant, it is the opposite. Heroin is a depressant. It's a type of drug that actually depresses or slows down the nervous system. Slows down the nervous system, and that makes the people feel calm or not feeling any pain, because this drug is used as a painkiller too. So the answer for this one would be B. Next question, what is the effects of alcohol? So alcohol is a disease. Which disease can be caused by excessive consumption of alcohol? So which is related to alcohol? Not bronchitis, that is smoking. Not emphysema, that's smoking. Not lung cancer, that is smoking. So cirrhosis is actually a disease of the liver. So cancer of the liver or damage of the liver. And this is true for people who are abusing alcohol or having too much alcohol, because the liver is the first one to be damaged, because liver is the one in charge in breaking down toxins, drugs, and all the other substances. So because liver breaks down the alcohol, so the liver will be damaged. So the answer would be cirrhosis. This is the last question. The diagram shows the label bottle of gin. There's 40% of alcohol. What happens during the next few hours when a person drinks large amount of gin? So their judgment of distance will improve. That's not true, because people normally are not allowed to drive with drinking alcohol, because they can't really tell if it's near or far. Their muscle control will be reduced. Yes, people who are drinking alcohol normally, you can see they're not able to walk straight. They're walking. That's one of the tests. Kalau people are caught with drinking and driving, they're asked to walk straight. If they can, then they're fine. But if they're not really able to walk straight, then it's one of the signs of drinking alcohol. Their reaction time will decrease. Okay, the reaction time will decrease, meaning the speed is less, or which means it is fast, right? For example, if you are running from point A to point B, Ahmed is running for 3 minutes and 26 seconds, but Fatima is running for 3 minutes and 15 seconds. Who is faster? Obviously the one with the less time is faster, so she will be the winner, for example. So less reaction time means less fast reaction time. Is that true with people with alcohol? Alright, so alcohol is a type of depressant and it slows down the nervous system. That's what it means by a depressant. When the nervous system is slowed down, reaction time will actually be longer, meaning the person is reacting very very slowly or lambat bergerak, therefore need to take extra time to think. So the reaction time will actually increase, not decrease, but increase. So the answer cannot be C. The answer cannot be D2 because when a person drinking a large amount of gin or water or any liquid, the urine output will actually be increased. So the answer for this question is B.